come in contact with any kind of sanitation wipes, whether it be cavity wipes or Clorox wipes, you want to make sure you put on gloves, protect your skin, protect yourself. You may have cuts, you may have abrasions. You also want to protect yourself as well as patients that you're going to be actually coming in contact with. So put your gloves on and wipe down. Get in there, don't be afraid. This will be the never cleaned before. This will be the first time. So. Make sure you create a nice, clean environment. I'm not sure if you guys, how much medical background you have, but you know, there's the right way and the wrong way to take off your gloves, even with something that's already made contact with the contaminated surface. So one thing I like to do, either grab the towel, I'm gonna just kind of pinch. I'm not gonna even touch my skin on one side. I'm gonna pull this away. This finger is gonna go on the inside of the glove, not touching anything. I'm just gonna, and everything that's dirty stays on the inside. This gets tossed, okay? So of course, by now I hope you guys had washed your hands, which you guys did. And you wanna make sure you grab your sterile gloves. One thing that you must check, and always check, is make sure for package integrity. This is something that's probably not said, but you want to make sure that your package is not punctured, doesn't have any wet spots or anything like that that can render this unsterile. Okay. Any questions or anything? No? Okay. So make sure you, once you open it, grab the edges, pop this open. Either you can grab the package from the inside or toss it to your field already. Now, one thing, always to make sure the outside of the package or the wrapper, you can actually touch with your hands. That's okay. You want to make sure that once you put it down, place it in a surface area that is nice and flat. Sometimes you may not have a surface area that's nice and flat. Sometimes if you're, I don't know, you're working on the patient and there's not a table or a bedside, you know, stand or a prep stand, you know, next thing to use is probably the one flat portion of the bed for the patient if that's necessary. But try to find at least a flat surface to work with. Once you open this up, you still, everything inside that you're touching right here is still okay to touch. Once we open this up, that's your sterile field. So I don't know if you guys can zoom in or check or look closer, get closer. There's little creases here. Those little creases are meant for us to either touch and open this way. And you want to fold away to make sure that it doesn't refold back again. If this folds back again and you already touched this portion, and want to talk about those margins in a second, this can actually contaminate your sterile field, and this glove will no longer be sterile. So you have to be pay close attention to all this stuff. This is open like this. You want to come back and do the same with the other side. Notice that I'm just grabbing the edge of this. You have a 1 inch margin. This is about 1 inch. And that's your 1 inch margin around the gloves, as well as at the edges here and at the edges here. That's your 1 inch margin that you can play with. That's not for you to be able to touch and make contact with. Anything inside this area is still sterile and must remain sterile. So with your non-dominant hand, what you want to do, you want to come in here, either pick the glove. There's a cuff that's folded, and that cuff is going to actually end up on the skin side of your arm or your forearm. So you want to make sure you grab and actually pull away. One mistake a lot of students that actually are trying this for the first time, and I'll just do this just in demonstration, don't do this, but instead of picking up the glove completely, you'll end up dragging it. And when you drag it, you have a tendency to touch those margins. So you'll end up doing this and then like don't pay attention and just drag it. That's unsterile now. So you have to pay close attention there, because if you don't, now you put in an unsterile glove and there goes contamination. You can actually contaminate your patient that way. So once you grab it, pull up and away. I used to take a step back. I don't want to be nowhere near anywhere that can actually come in contact with the tips of the gloves. So one thing you want to do, once you open, create a nice little opening there. Let gravity work for you. Meaning if you're actually doing this way, hands or palm down, it's better that your fingers of the gloves stay pointed down. If you do the other way and you come this way, look what happens with the gloves. The fingers can actually start touching the other hand, and now you contaminate. So make sure you point them down. And actually, there it is. I was like, don't do this to me, not right now. So you want to just grab it, let go. That's one hand, right? Now, the other hand, instead of grabbing it the same way, we're going to go on the inside. of the cuff. Because you're now sterile with sterile, that's okay. There's a little cuff here, and you wanna, again, do the same thing, pick it up, and move, step away. Notice this little cuff there? All you have to do is just go into the opening. Look at my fingers, they're inside the pocket, thumb's facing out. I don't want my thumb inside here, because once I roll it over, this thumb's gonna contaminate with your form. So keep your thumb facing out. All your fingers are away. Now you're sterile. Now, if you wanna get rid of that package, how would you get away with this package? Throw it away.
In the middle, maybe?
Yeah, either come in here, grab it in the middle, and dispose it, okay? And that's the way you put your sterile gloves. Any questions? All right, it's your turn. I get to record you guys.